clothes like PP kits, like other that better that important for protection. And as maybe you heard in news that we lost our 6 or 7 doctors that infected by this virus, and more of doctors have infected. And when I tell that when doctors infected, who will, or medical staff infected, who will treat other people? Uh, we have so problems here, like that. I told that people with kids, like other things, and medical staff are here in the high risk of infection of this virus, and we suffer from this. But the public ministry, health ministry of Afghanistan attempt to achieve this kit from other country like China, like Korea, or other donor country that can help with Afghanistan. They do their attempt, but this is not enough. Better we need to more kits, more mask like other country, and we can buy it, and we must keep them from donor countries. And yeah, we have these problems, and our dentists, especially in high risk of this virus.
Ahmed, you told me a lot about dentistry. Now I'm going to ask you a completely different question. Tell me, why is Afghanistan a beautiful country?
Uh-huh. As you know, maybe you see some videos in television. Afghanistan have a great weather, nice places to stay, nice places to picnics, also pure and natural places for watching, for seeing, for traveling. And Alhamdulillah is a Islamic country and have a very good Islamic culture that we can invest Afghanistan with, but unfortunately, better we have security problems in Afghanistan and or in more countries. If we solve this security problems, we can uh, say that Afghanistan is one of the beautiful countries of the world.
So I have had the pleasure, I've eaten Afghani food before, and I've lived in Pakistan for a very short period, I've told you. So I had a lot of Afghani friends, and I've enjoyed your cuisine, tremendously. And someday I hope to visit Afghanistan. But let me ask you a different question now. Back to COVID-19. How do you see dentistry changing? Now that we're going to need maybe a higher level of PPEs, how will that affect dentistry in Afghanistan? What do you see in the future of dentistry and medicine in Afghanistan? How is it going to change in the next year, in the next 6 months?
Uh, as I told that we have lack of specialists here and high level medical staff. We need to train our more doctors here, or they can travel to other countries because of financial problems. Most of doctors can't go to other countries, get fellowships, get their specialty or mastery. Because of, and also because of financial problems, they can buy machinery that we need to machinery. We need to high level medical staff that we have lack of them in Afghanistan. Um, but when we have more specialists, or they uh, use from experience, they travel to other country and see the other work with other doctors and use from other experience of that doctors, and comes back to Afghanistan. we can improve our dentistry or our other medical fields. And shortly, I can say that we have lack of high-level medical staff like specialists, like masters. Uh, we need to train more doctors, more medical staff, more dentists in this case. Also, we have a lack of machinery facilities in our hospitals. We have lack of for this virus. We have lack of PCR machine and all kits that we have for this for testing because of coronavirus that donors like China, like Korea or other country help us and help, but we haven't because we haven't some center that make it or produce or product these things. Uh, we can say problems, but for better, we can how we can better. In this case, need to train our doctors out of Afghanistan because they are higher education, they are standard textbooks here and there, and we need to more specialists, more high medical staff here to treat patients.
Ahmed, you know the world has seen and learned about Afghanistan through the war and through um, a lot of negative things. You know, the world, the Afghanistan that I know is very different from what is portrayed in a lot of parts in the world of what Afghanistan is. Uh, but you know, I've only met you. This is the first time we've actually seen each other and spoken to each other. So it's, you know, brings me great pleasure to see your clinic, to see the equipment you have. And I have to be honest, uh, your practice looks much uh, more better equipped than I expected your practice to be. So obviously, even I have a misconception of what Afghanistan really looks like, what dentistry looks like in Afghanistan. I want you to utilize this opportunity. Tell the world, what do you want everybody, what do you want the doctors, the dentists in the whole entire world, what do you want the world to know about Afghanistan?
Yeah. Uh, uh, and please, can you say this question
No
again?
problem. Tell us, what do you use this opportunity uh, to tell the world, what do you want them to know about Afghanistan?
Yeah. As you know, Peter, if every country have its good side and bad side, but unfortunately, media reflect the bad side of Afghanistan more than, or when we see some Afghans go to out of Afghanistan, they work do bad things that we and one person when do a bad work or bad things, they see all of Afghanistan from this angle, that all people of Afghanistan may be very bad people, or Afghanistan may be home of war, or it's home of place you see everywhere or watch every day in media that the people of Afghanistan say before everything they don't want food, but they want peace. Yeah, that media just reflects the one side of the problem side of Afghanistan, but they didn't reflect yet the good side of Afghanistan. Also, you know better every country. We can't say just Afghanistan. Every country have good and bad sides that we must reflect good sides bit more than and problems is everywhere, but we can't say uh, when we see one side of problems or one side of country, we see, oh, this country is very dangerous, or very bad people have or bad culture that have. Uh, as I told that when I've gone in foreign countries or maybe like in Germany or in Turkey, bad did bad work or bad things like in Christmas, you heard in media some Afghan boys do some bad things, but from this angle, they watched Afghanistan, all of Afghanistan like that, unnormal people or bad people, and I'm also suffering from this. That why word see to or to look to Afghanistan very very bad, but by but I accept that no one worked in Afghanistan, or maybe few people work for Afghanistan that showed the good side of Afghanistan. But when we work for this, we can change the mind of worst people about Afghanistan. We need to work on it, and
So, Ahmed, let me ask you two final questions. The second last question. What makes you happy?
yeah. Makes me happy. And first of all, every person or all, every people of a country want improvement of his country, peace in his country. Also, I hope very, very that get my specialty or get some fellowships or make my improve myself in dentistry in my field. Also, serve to my people or every uh, the people that have need to need to help them. Also improve myself and make my uh, life, my future life, and make for myself comfortable life.
What do you
Uh,
want to specialize? What specialty do you want to do?
I like more in orthodontics or in endodontics, or maybe and I like more dental implant, sinus lifting, splitting, like this. I don't know in which case I will get specialty, but I hope so. You see that. I have very textbook here that sometimes I come here to this room and study textbook, get read me, and prepare myself to that. But I hope one day in every case that I like, or maybe in ortho or endo or dental implant, get my specialty.
So, if you can visit when this virus is gone and you can visit any country in the world, where would you like to visit?
Where I like to visit more of few countries like the United States, like Germany, like Canada, UK, and Turkey.
You want to go to a lot of places and you want to learn a lot. Ahmed, thank you so much for taking the time to allow us to have this interview. The goal is we want everybody to learn more about you, and we want everybody to learn more about Afghanistan. We are one profession, and we see so many commonalities between you and I'm sure everybody else. I hope in a couple of weeks, when all of this gets better, God willing, we would love to have you come back and do another interview. Thank you so much, Ahmed, and I look forward to talking to you again. You have a lovely night, my friend. Thank you.
Thanks much from you, and have a good day. Have a good Ramadan for you also. That
Thank you.
both have.
Thank you. Cheers.